Hello and welcome to The Skin You're In. I'm so glad you're listening. Please, if you haven't already, give us a like and a follow. It helps other people find us, and I would love a review. Today we're going to be talking with my friend Katie Ashley. She's an experienced practitioner in the UK, and she does really beautiful work with dermal fillers. So we're going to be talking about dermal filler for anyone who really doesn't know much about it or is a little bit nervous about it. This is kind of like a primer on dermal fillers and how we use them in your face. Now, in this conversation, we're going to use the word volume a lot, and I'm kind of feeling like that's too much of an industry word, that it doesn't mean a whole lot to you, the listener. So I wanted to give you just a brief primer on how our faces age over time to help you understand why we're using that word volume. So you think of an old lady, a 90-year-old, and a picture of her when she was 20. Her face looks different in those two scenarios, right? And that's due to three things in her face that have changed: her bones, her fat, and her skin. Our bones age by actually getting smaller over time. So your nice high cheekbones or your nice cut jaw actually gets smaller, leading to all of your skin kind of drooping a little bit. In addition to that, your fat pads age. So your nice chubby little 5-year-old cheeks, they either get smaller or they just fall due to gravity, causing jowls. And then finally, your skin ages. You lose things in your skin that give it youthful appearance, things like hyaluronic acid, elastin, and collagen. And that leads your skin to get stretchy and thin and to not bounce back into place when you make facial expressions. So when we talk about volume or revolumizing using dermal filler, we're talking about mimicking bone or fat to give you a more youthful contour. So that can be in the cheek area to give you back your cheekbones that you've lost, in the jawline, in the chin. In females, aging actually gives us a more masculine appearance because our chin gets smaller and it gives us a squaring off of the face rather than a nice heart-shaped face, which is very feminine. So those are all ways we can use dermal filler. I would love to hear your responses to this. If you think it's too confusing or complicated or was not helpful, please let me know. I really want to serve you and make things really manageable for you and empower you to make decisions about whether or not this is right for you. I'd love to hear your thoughts. So Katie Ashley, welcome to The Skin You're In. How are you feeling in the skin you're in today?
A little rough around the edges. I went out with the girls last night, but I've got my makeup on, so hopefully I'm looking a little brighter than I feel.
You look beautiful, and I love your Spice Girls t-shirt.
Thank you, thank you.
I love it. I love it. I was totally a Spice Girls. Did you know in high school I won the lip sync contest doing Wannabe?
Did you?
And I was Scary Spice.
Were you? Do you know, I always was. We had a group of like 5 of us and we all had to be one. So I would always be scary. Obviously, it's the mouth. It's the mouth.
No wonder we get along so well.
I think we should reenact that one day.
Yes. Yeah, 2 Scary Spices. We just need a couple of wigs.
I'd love it. I'd love it.
Yeah, I don't think you can tell really on the video, but I'm looking a little rough. I had some under eye PRP injections, so I'm a little puffy. Can you see?
I'm excited to see the results of that because
I love them.
I don't do that treatment, and under the eye is where I could do with a little bit of help. So I'm interested.
I love it. It's not for everyone and it's not for everything, but for what was bothering me, it works really, really nice. I love it.
Good.
And I have these like moms of young kids that are like, I just look so tired, and it really just brightens everything up on the under eye.
Exactly what we all want.
I know, but it's hard being the provider to allow myself to look a little rough because I this is probably just I put it on myself to like look great all the time because you're trying to tell people if you have these treatments, you'll look great. So I feel like I can't look not great, but sometimes I have treatment and I look a little rough for a day or two.
But I think also if you know, if I wanted to be one of your patients, I would want to see that. I'd want to see that, you know, oh, here are the bruises. Like, for example, on me today, I've got a bruise here under this, you know.
Yeah, like that.
Yeah, bruise there. It's the reality of it. And it is nice to experience that you have to have either, whether it's downtime if you're somebody that, you know, wants to hide the bruises, or if you know, kind of don't mind and you're like, oh yeah, I've been for a treatment. A lot of my ladies will say, I've been for skin treatment, you know, rather than Botox or fillers. And then it could have been anything, couldn't it? You know,
a facial.
Yes, exactly. She's got beaten facial.
Very, very firm facial.
She got beat by her beautician.
Yeah. So I was glad that I did it, because in the process of like having the experience, I realized that the tape that I have in my office is like not nice, and it like is very scratchy and stiff, and it hurts your skin when you take it off. And I was like, oh, look at that. I need different tape. Like I just learned how to make my patients have a better experience by doing it myself. So.
Absolutely. And I think that's really important for us as well, is I try for each treatment that I offer is to experience it myself as well. When I'm sat in the chair, sometimes you feel a little bit vulnerable sat in that chair, and I think nice to remember that, you know, and then so then that just keeps that empathy there for your patient, knowing kind of how they're feeling. The more that we can try, the better, I think, for our patients.
Yeah, agreed. Speaking of our patients, we're here today for patients, maybe somebody who's never ever had treatment, and we're going to talk about dermal filler. And I really wanted to talk to you specifically because you do a lot of filler in your practice, right? I see your before and afters, and you are extremely talented. I mean, just really beautiful, subtle, natural, so beautiful before and afters.
Thank you.
And you've been doing aesthetics for 4 years, right?
Yeah, 4 years. So I'm a nurse. I'm a psychiatric nurse. I've been nursing since 2008. I started as an injector 4 years ago, and 2 years ago went full time. So I'm full time in practice now, injecting.
So you've done this a lot. You've talked to a lot of patients, a lot of first-time patients. And what I'd like to do for our patients listening or people listening who've never experienced filler is like start at the basics. And how would you talk to someone coming in? Because the filler that we see on TikTok, Instagram, etc., or even walking down the street is generally not good. Because if you notice it, it's not done well.
Absolutely. Yeah.
So how do you talk to people who come into your office and you're like, okay, filler is what's going to help you get the result that you want?
Yes. Yeah. So often how I talk about it is in a way that say, for example, a lady comes in and she's feeling a bit flat here, like say mid cheek, she's feeling a bit flat there. What I will discuss is that we lose volume here. And then because a lot of people moan about is kind of down this area here and flatness there.
For anyone who's listening and not watching, she's squashing her cheeks together.
Like this, yeah.
That creates that fold on the side of the nose and down the mouth, which is often what people come in saying first.
Yeah, so
it's called the nasolabial fold.
Or the marionette lines there. Yeah, so I will talk about volume loss and the effects that it has, like from the top of your face down to the bottom of your face. And I will describe the filler as adding the volume that they've lost. So revolumizing, but without, and I do use the words like without making you look crackers, without making you look crazy. I do say this because these are the words that they would use as well. And they're like, yes, like few. That's exactly the way I don't want to look. So I say, we won't be giving you like ledgers on your cheeks here. It's literally just to replace lost volume. So in essence, I'm not changing your face. I'm just taking it back a few years. And I always say it's so subtle and it's so beautiful, because this was the thing that I struggled with. Just say, for example, with cheek filler, it's very difficult to catch it on a before and after because it's so subtle and it's like less than millimeters or millimeters difference. It's very, very difficult. But I always say, I used to think to myself, I absolutely love doing cheek filler, but I thought, what is it? Like, what is it about it? Because it's so difficult to go, oh my, like when somebody's had the lips and you're like, oh my gosh, yeah, you can really see the difference there. But it's what I say is it's beautiful. It's very feminine. So it just gives this feminine lift again here and just takes a few years off. So again, taking them back to how they looked before, not changing the shape of their face.
Mm-hmm.
So it's never going to be that dramatic. I also speak to them about, with regards to filler, well, initially I explained that it's dissolvable. And if they don't like it at any point, it can be dissolved. That's always a sigh of relief for them, because I don't think they'd even thought either way as to, if I don't like it, what happens. I think they might be stuck with it. And then I also speak about, and I don't know, you probably do the same, but I always explain the amounts of the filler that we use in. So I say, the teaspoon that you put your sugar in your tea with, so the little one, and they go, yeah, and I go, that's 5 ml. So we're using 0.5s and 1 mls, maybe up to 2 ml, depending on what's needed. So we're talking at either a tenth of a teaspoon, a fifth, half a teaspoon. And they're like, and I'll say, so it's tiny, tiny amounts, but it can make a really beautiful difference. Mm-hmm. So I think talking about it in that way, they know it's reversible if they don't like it, and if they don't want it, they know that you can build it up. You're not going all in, and it's going to look a particular way. If you want to start with really tiny amounts, get your confidence in that injector, just being in the surroundings that you're in, experiencing the treatment itself also, and then going away and experiencing the recovery as well, then they can always come back and get more.
I totally agree. And it's so funny. I was actually listening to a podcast that was directed at injectors, not at patients, saying you should never say it can be dissolved. And from an injector's perspective, of course, and a patient never wants their injector to be like, oh, whatever, if I mess it up, we can just dissolve it. That's not what that means. No. But I do find that patients really take kind of comfort in the idea, like, because they still have this in their mind, what if I don't like it? I really do think they take comfort, like it can be reversed. So
I would find that like a relief, like, okay, so this, even if I hate it, we can get rid of it. It's not going, I know they're never going to want it dissolved.
Yeah.
That has never happened. So because the results are so beautiful, and if anything, they're coming back because they're like, yeah, that was safe, but I would like a little bit more to just note it. But so everybody's different with that, with how they talk to their patients about it. But I'm always less is more. So I would, and I know that, well, we know, don't we? Your vibe attracts your tribe. So I know my patients come in wanting less is more.
Mm-hmm. And I totally agree on the before and afters. I have a really hard time at this point. I'm like, I don't even try to kind of post before and afters of those, because what I really love is like a full facial rejuvenation. So I'll do like tiny amounts in the cheeks, along with tiny amounts in the temple, tiny amount in the angle of the jaw, tiny amount around the mouth. So when I try to capture that in photography, it's so subtle that I feel like I have to like put arrows all over the place.
Yes.
Here's where I did it. And but the thing that like I always come back to is that those patients, and I guess, everybody kind of just has to take me at face value, like they walk out the door and they are so happy. I keep coming back to this thing that I say all the time, which is it's not about how you look, it's about how you feel.
Absolutely.
And they walk out the door feeling amazing, and it just like shines through their faces, and you can't capture it in a photograph.
And I think with that, what's nice, and I know what my patients are really grateful for, is those reviews from those patients, because again, it doesn't, the before and after is really helpful for a lot of people to see. But in those instances, like you say, there aren't many of my patients that would allow me to put their full face on. So we're a bit stuck with that, aren't we? So I think getting their comments after, so feedback after, so then when my patients, so I have got a reviews part, and they will go to that, and you can hear it in the review, like how happy they are. And like you say, that's all it's about. That's absolutely all it's about, because I'll have ladies coming in saying to me, what do you think I need? And I always say, I don't think you need anything. Like, I don't look at faces and think you need anything. I love all the different faces. But what I want to do is, whatever is bothering you, you tell me what's bothering you. I'll tell you what treatments I can do, and you choose. And then we go from there, because it's about how they feel. There's no I wonder from a patient's perspective if they're thinking, are they going to be judging my face? When I sit down, are they going to be looking at this and thinking I should do this and this and this? It's never about that. It's always about what's bothering you. And if there's something we can do about it, you can choose what you want doing.
Yeah, I totally agree. People say that a lot, what do you think I need? And I'll say, oh, you don't need anything, but
Yeah,
what's bothering you? Let's focus
yeah,
on what's bothering you. And then if
yeah,
you love it and you have the finances to keep going, we can
yeah,
always continue improving, particularly in skin surface. Your skin
yeah,
surface can always be improved.
yeah,
Um, but let's deal with what's really actually bothering you, and then
yeah,
you're gonna feel so much like better. That's
yeah.
where you get it from. And it's actually why for the skin you're in, I'm not sure if you know this, but I'm interviewing patients who have had treatments and letting them tell their story. I'm a whatever, I'm a mom or a single mom, and
I love this.
really thin upper lip and it bothered me. And with COVID, I was on a lot of Zoom meetings and telling the stories. And I've had some feedback from people being like, well, are you going to show their before pictures? And I thought about it for like a hot second. And I was like, no, because
That's
it's
not what this is
not
about.
about what they look like. And it
Yeah,
doesn't matter what you think they look like either. It's
yeah,
what they wanted, which
yeah,
is like the beauty of finding an injector who's really excited to hear from you about what you're looking for and what bothers you, what makes you feel great. And then when you have that relationship, you might like I have a couple patients who like they get hooked on something and they're like, I really love that, I want that, or I want more. And I'll say, you know what? I'm concerned that if we do more, we're going to go over the edge. But I think I know you well enough that I think this other treatment would really make you feel great. I think it would
yeah.
deal with some of the other issues that they're having. And I can go there with some patients.
Yeah, but
Um,
that's absolutely right. But that's what they would want also. What I always say is because a lot of ladies will say, won't they? I've got a list as long as my arm of things that I don't like. And I always say, right, where's the thing that bothers you the most? We'll start at that. We go with their budget, start at that. And then often what they'll find is, say if they've got 5 things on the list, you do the first two, the other stuff doesn't bother them anymore. Because it's a bit like when there's a couple of things, everything bothers you, but then just soften a couple of lines or give a little bit of lift or a little bit of revolumization or plumpness to the skin, whatever it is, and all of a sudden the other stuff's not a problem anymore.
hmm Yeah, I totally agree. And I've had patients that I find a lot of women in, kind of like around the 40-year mark, they start to notice changes around in their lips and around their lips. So in the
Yeah,
right part of the lip, they get those lines. Some people call them smokers lines, although there's not many smokers left anymore. But
no,
from using straws, or some people I find when I just watch them talk, they have very tight muscle tone in the area around the lip. And they come in and they'll say, well, this is what bothers me, but I don't want lip filler. And
yes,
I'll say, well, if that's what bothers you,
yeah,
the reason that that's happening is that you've lost a layer of fat between the muscle and the skin. We need to put a little bit of barrier in there so that your muscle isn't just directly pulling on your skin. And then when I restore the barrier between the skin and the muscle in the white part of the upper lip, then the pink part of your upper lip is going to look imbalanced. So you might want at least a tiny amount within the pink part. And when we go about that conversation, they're like, oh, okay, I see how that works. Because to
yeah,
them, filler is just big fat pink sausage lips.
absolutely, absolutely. And it is the wording as well, isn't it? So I have people come for lip hydration. It's lip filler. It's filler in your lip, but saying it in that way for them is less frightening because the image that they've got stuck with lip filler is like what we know with the big trout pout and everything. So just having the hydration in it is having lip filler, isn't it? But it is probably the wording around it and knowing there's so many different functions to having filler in different places and the different fillers that there are.
Well, and two, I think the word filler is kind of problematic because it literally, to your brain, filler means full.
Yeah.
when we
Yeah.
when we as healthcare providers who are doing dermal filler procedures, when we talk about filler, so let's say our patient that's come in for a consult and they were like, I don't know what I need, but I this is my issue, and we've come to the recommendation like you some dermal filler is indicated for this issue. How do you talk to your patients about what exactly filler is? Because when we say filler, we're talking about a thing. We're not talking about fullness. So
Yeah.
how do you explain to your patients what filler is?
There's a couple of way conversations that I have anyway, in that we initially just talk about the area of concern and how I can fix that. And I don't always mention that it's filler straight away. I say I've got a skin strengthening technique that I've learned. And then I will say it's using filler, but not filler to volumize, it's actually to strengthen the skin. And then I go back to the basics with, I always say, you know how kids' skin looks so amazing and it's so strong and they've got no lines. It's because their skin is full of strength, it's full of hyaluronic acid. The filler is made of hyaluronic acid, so it's re-strengthening your skin. So that's what we're doing. But I understand that initially when you hear the word filler, we always think volume. And I always say, but there are so many different techniques and there's so many different firmnesses of each filler depending on where we're using it. And then I'll talk to them about the different fillers and what they're used for, as to whether it's to, replicate bone or whether it's just to strengthen some tissue. And just reassure them. And I think through discussion anyway, for them, they gain that confidence, that because I keep reminding them, you're not going to look crackers, you're not going to look and think, oh my gosh, why do I look like that? Literally, it's just going to be that you don't get the indents and the lines there.
Yeah, I agree. And I usually tell people, I'll say it looks like clear grape jelly that's been pushed through a strainer. It looks like
Yeah,
grape jelly. And
yeah,
and I also talk to people a lot about like, 20 years ago when filler first came out, there was basically like one type that was one consistency,
yeah,
and no, providers really hadn't figured out how to use it well. So it was basically like shoving a brick under your skin, and it looked really obvious. And they, practitioners really hadn't figured out, oh, we need to place firmer filler deeper so that it doesn't
yeah.
look obvious.
Lumpy, yeah,
And they began doing that, placing it deeper. But then when you place something deeper, you need more of it to have
yeah,
the same effect. So
yeah,
we ended up with people getting a little bit overdone in one or two areas. But the other really important thing I tell people now is that we've got fillers, as you mentioned, that are all different strengths and they're all different stiffnesses. So there
yes,
are fillers, there are hyaluronic acid dermal fillers that we can place directly into like the very surface of your skin, and you will
yeah,
never see it because it
yeah,
literally is just strengthening your skin.
yes, yeah, yeah,
So it's
absolutely.
not the same as it was 20 years ago. The technology has actually come a really long way.
Yeah, and I think that just that education around that is massive, and because it's just people know that they want something, but they're not sure what they want. And of course, we don't expect for them to know all this. Often people will come maybe just for one area and just think, obviously they want to try it and see how they get on, but then as they get more relaxed, they want to discuss other things. But this is another thing as well. So a lot of my ladies will say, but what if I really, really love it and then I want to keep coming back for more, but and then I end up looking crackers? And I'm like, right, yes, everybody says this. And the other thing is, I think when you're choosing your provider, you know, you're also getting the knowledge and the trust that if you asked for something, and this is what I always say, if you asked for something that which I feel would make you look done, I wouldn't do it.
Mhm.
I would explain to you, no, because I think this is going to tip you into looking done. And I know that that's what you don't want. And again, I know they gain comfort from that as well. They gain comfort from me saying, no, you're not ready yet. Or, leave it another 3 to 6 months because there's still quite a bit in there. Let's not, overdo it.
Yeah, exactly. And I have a couple of people that I've been like, and they're like, oh, I just love it so much. And then I start talking with them about like, it's kind of a head game too, because once you look at yourself in the mirror for 5 days, you don't really remember what you looked like before.
Yeah,
So then they can start to think, well, that it didn't last. It went away.
yeah,
Why did it go
yeah,
away? So they'll
yeah,
come,
yeah,
yeah, I want more. I want
yeah,
the lips, a little bit more in the lips. And I'll
yeah,
say, so what I explain to people as like kind of the psychological phenomenon, which you as the psych nurse, you should probably tell more about this, but I'll say
yeah,
what you're loving is the kind of little happy chemicals rush that you get when you feel
yeah,
beautiful. And
yeah,
if
yeah,
you want that feeling, I feel beautiful, I feel refreshed, we can do that in other ways. Even
yeah, yeah,
getting like a nice facial or a chemical peel will give you beautiful glowing skin. And if
yeah,
that's what you're looking for, there are other things we can do to help you feel really beautiful, but
absolutely.
more lip filler is not the way to do it.
Absolutely. But I also love as well just getting, I'll go, oh, okay, right, let's get your, and I'll say, send me your photo now. And then I put it up with the one before and I
Yeah.
just send it to them and then they go, oh yeah, I can see there's still a lot in there. Yeah, that still looks really nice. And I can't believe they used to look like that. Gosh,
Yeah.
I think, and again, so sending the before and afters beneficial for that. But the times that I haven't sent it or, not kind of, they've not asked for it, then it's always really helpful to show them their before.
And I always tell patients, like, make sure you have a good before picture of yourself so that
Yeah.
you have something you can look at to feel good about the choice that you made to come to me and have treatment. And, I
Yeah.
want you to feel good about that.
Yeah, absolutely. Absolutely.
Now, how do you talk to your patients? So you have a patient that came in, you've decided that dermal filler is the appropriate treatment. You've talked about what it is. How do you talk with them about complications? So I can start. So botulinum toxins are easy. They're very low risk. Even the risks that are possible are always temporary because botulinum toxin is a temporary treatment. Dermal
Mhm.
filler is a little bit different. Because it is a jelly, if it's placed into an artery, it will occlude flow through the artery and it will prevent oxygen from getting to tissues where that artery um, goes. And if that
Yeah,
happens, we'll pretty much know right away. And I will inject the medicine that dissolves the filler and make sure that tissue blood flow is restored.
yeah,
Tissue death doesn't occur for 3 days, so this is not an emergency; it's an urgency.
yeah, yeah.
But we're going to deal with it, and I have other people that I can reach out to for help if we decide we need it. And in the very, very rare case that you think this is happening after you've already gone home, you're just going to call me and we're going to meet at the office and we'll deal with it together. And
Yeah,
everybody
yeah,
has my cell phone.
yeah. That's exactly what I do. So I always say I kind of do it with I say, for example, if we were to block the artery and the blood's not flowing through, I say if left for too long, the tissue this side is going to die. And then I say, but this doesn't happen immediately. So I always say to them, I say, if you decide you want to go ahead with this today, and they're always like, I've already thought about this. I definitely want to go ahead with it. Because they've already done the research anyway. I always say, when you go away today, I'm going to be saying to you, just say, for example, it's lips. They may feel a little bit tender. They may be bruised. You can take paracetamol, but if you get any pain or anything that you're not sure about, just message me. And I think my clinic's at home, so they know I'm not moving out anytime soon. I'm not going to disappear. So I say I'm always here. So if the case is that we have any indication there might be an occlusion where the blood isn't flowing through, I always reassure them because I've got a large stock of the dissolver in at any one time. I say there are a number of things that we can do before. We'll be, take an aspirin, apply heat, let's see, pop on over. They will then come round to me and I'll monitor it.
Mm-hmm.
So that's kind of what I say to my patients.
And I always tell this little secret, which I probably shouldn't put out into the world, but did you know that if your phone is on Do Not Disturb and you call 3 times in a row, it will overcome the Do Not Disturb? Did you know that?
Oh no, I didn't know that.
Yeah, so you can
Mine's,
start waking
mine's,
everyone up in the middle of the night.
mine's never on Do Not Disturb, but it is on silent. at night sometimes. But again, you know, this, like you say, there's not going to be
Yeah.
an
Yeah,
infinite.
so yeah, exactly. I say, listen, just call me and we will figure it out together. And then
Yeah,
symptoms of an occlusion, meaning that dermal filler has been placed inside an artery, are things like extreme pain. You should never have extreme pain when you're having dermal filler.
no,
Soreness, yes. Sensitivity, yes. You don't want to push on it, yes. But just sitting here watching TV or something, you should not have pain. That's not normal, and you
no,
should contact your injector. Um, and then if you have white appearance or gray appearance, particularly if you press on it and it doesn't turn pink again, that's a a sign that you might have an issue and you need to call your injector. But in
yeah,
general, pink, red, purple, that's all blood and that's swelling and or bruising, and that's okay. But
yeah,
if you're ever concerned, you should reach out to your provider because it is an important complication.
yeah.
Very, very rare though. What did we did some research. What did we decide was the incidence?
Well, it's less than 1%, isn't it?
Yeah. I want to say it's 1 in 300. I was thinking 300. So it's pretty rare. I mean, you think
Yeah.
about trying to put a needle in a piece of thread, basically. That's how
Yeah.
some of the arteries are in your face. So we don't want to mess around with it. We take it very seriously, but at the same time, we do like to talk with everyone about it, make sure they know how to handle it.
Absolutely.
Lumps and bumps are totally normal for the first 4 to 6, even 8 weeks. If
Yeah.
it persists beyond that and they bother you, because
Yes.
sometimes like you can feel it under there, but
Yeah.
it doesn't, you don't see it, it doesn't bother you.
No,
So
and,
if
and
it
th
bothers
that's the
you,
yeah, that's the other thing is it's doing a job, isn't it? And that's what I'll always say because some of my ladies. So, for example, if I've done filler down here, sometimes more superficially in this, and I had a lady the other day, and she was like, "Well, when I do this, you can see it," and I said, "Do you walk around going like that?" And she went, "No," and I went, "Well, you're okay then." So I was like, "Yeah, no, there is product there, so it is doing a job. As long as you can't see it,
yeah,
generally day to day, and it's doing what we want it to do, then that's fine. But I get it; it's new and it's in your skin. You know, it's underneath your skin.
yeah,
It's you're not going to know until you ask.
yeah. And all of the other kind of like little like quote unquote complications are things that aren't going to injure you. They're not going to really, they're going to be pretty manageable in the moment. If you think you're having an issue with your filler, contact your injector, do all the things that you should normally do. But the occluding a vessel with dermal filler is an issue that needs to be dealt with immediately, basically within
Yes,
3 days.
yes, yeah,
But everything else is kind of like, okay, we're going to handle this.
yes, yeah,
Okay, so we've covered what is filler, complications, risks. We've touched throughout about how it can help restore, contour to the face. I often will tell people it's not about even necessarily lifting. Lifting is kind of a taboo word in dermal filler because it really doesn't lift, in contrast to a face lift, which actually lifts. But I will say it helps to soften the light and shadows on your face, and that's what's just distracting your eye. So
yeah, yeah,
often the under eye shadow is something that really bothers people. And I'll say I can soften that shadow, but be careful about wanting to obliterate something that's normal. Like go home
yeah,
and look at your 5-year-old. Your 5-year-old has a shadow under their eye. The
mm,
difference is that in your 5-year-old, the shadow continues up to the lateral, to the outside part of the eye. And so it's not distracting too because it frames the eye nicely. What becomes really distracting is when the shadow continues down the front of your face. And
mm,
I can adjust the way that shadow falls by using dermal filler. And that's how I usually describe it to people. So it's not really a cure all. It's not going, if you're 75 and have really loose, thin skin, that's probably not, at least not the only treatment that you'll want.
yeah. I talk about
Things, but
Yeah, I talk about the illusion. It gives the illusion of lift. About
yeah,
that
it
too.
kind of just draws the eye up, draws
Upwards. Yeah.
When you
And
look in the mirror, when you look at someone else, it draws the eye up to the eyes, which is where you
yeah,
want them to be looking. And
you know,
sometimes too, I'll say to people, if you would ever consider having a facelift, I would recommend going to a surgeon and talking with them and deciding if that's something you want to do. And then after you have the facelift, dermal filler might still help you, give you
yeah,
contour that
yeah,
you would like. But it's best to do that after the facelift.
yes, yeah, absolutely.
Awesome. Well, I realized that I never got to ask you at the beginning, Katie, will you tell us where you're from? Because you have a lovely accent.
Yeah, so I'm from the UK, in England, a place called Derbyshire, like Middle England.
Derbyshire.
Derbyshire.
When we first met, I tried to teach Katie how to have a Boston accent, and she tried to teach me how to have an English accent.
Yours is much better than mine.
I don't
That's all
know.
I'm going to say.
Well,
Chop
it
me.
might not be fair because I'm not actually from Boston.
Ah, right.
I'm
Okay.
from New Jersey.
Oh, okay.
I should have
Okay.
taught you a Jersey accent because I can do that all day.
Yeah. Next time.
It's
Next
not
time.
flattering. Well, thank you so much for coming on and sharing your expertise with us.
Thank you for inviting me. And I love what you're doing here with this, all aimed around from the patients, because we see lots, I suppose we get to see lots of these, whether it's lives or, whether it's on YouTube or wherever, but it's always teaching the injector. Whereas I think, to focus this on the patient and from their perspective, which sometimes is a little hard for us to get back into it once you've been injecting for quite a while, is really beneficial. So,
Yeah, I hope it helps people. I hope it destigmatizes a little bit. I think that aesthetics in general are continuing to rapidly change because it's actually such a young field, really.
yeah,
And it's just continuing to change. So it can be really scary for patients to decide, okay, I want to go in and do this. So
absolutely. And
hopefully,
because there is so much choice now as well, there's so much choice. So just being able to get this educational stuff and these tips and just a little bit more information, they're going to feel probably more confident than walking in, especially when they come in to see you. They've already seen you on here. So,
and you.
yeah, like
All
your
right.
internet friends, isn't it? You meet
Yes.
internet friends. You think you already know them. It's kind of nice. I like it.
I do. I have a lot of people come in and say that they feel that they already know me, and I'll say, "Well, if you watch me on Instagram, you do because that's the real me."
Yeah, yeah,
For
yeah.
better or worse, I don't hide.
Very entertaining. Very entertaining. So keep it up.
Oh, it's good to see you, and
Thank
we'll
you.
chat again soon.
Yes, lovely. Thank you.
Thank you. All right, I hope you enjoyed that conversation. Please again give me your feedback. Let me know if that was helpful. And come back in 2 weeks. I'm going to be talking with a client of mine, Jane, who actually felt her transformation came from dermal filler. So stay tuned for that.